that. And everyone in the comments was like, honey, this is what you voted for. This is Medicare cuts. This is the big, beautiful bill. And she was like, no, that's not it. Yes, it is. I work in skilled nursing. 90% of the residents that are in there, they are Medicare patients. These buildings stay open because of Medicare. They will close down. They will not care for your aging parents and grandparents for free. They will send them home to you. You will have to quit your job and stay home and take care of them. That means you're going to have to be the caregiver for your father, your husband, your kids. You're going to have to quit your job. You're going to do all this on half the income for your household. This economy is going to suffer greatly when these places start closing down. This is one of the reasons, this is the main reason why I did not want to rely on the U.S. for my income while I'm living abroad. The economy here is bound to crash. When you cut Medicare like that and these places close, a lot of people are going to lose their jobs. The dollar is going to suffer. There is no forethought with these people. They have no idea what is happening.
If 17 million Americans lose access to basic life-saving care with cuts to Medicaid, it won't just hurt them and their families, it'll hurt us all. Within 10 years, Medicaid cuts would force the closure of over 300 U.S. hospitals. And no matter if you have insurance or not, if your hospital is closed, you're not going to get care when you need it the most. Destroying the system is not the answer. If we really want to make America healthy again, we must finally guarantee care to all Americans.
Now, I thought some of y'all were just being a touch dramatic when you were saying how bad the American healthcare system is. However, no, I'm learning the hard way. You are not being dramatic. My 65-year-old father had pneumonia, some other complications about 4 weeks ago. So went to the hospital, has been on a ventilator in the hospital since then. At first it was in his throat. Now there's finally a trach put in about a week ago, and he is still hooked up to the ventilator, cannot recover on his own, needs some help. So they recommended that we have him go to, this week, a long-term acute care, respiratory therapy facility where they can get him breathing on his own again and get him better and give him quality of life back and get him off the ventilator. And that was until I received a letter from United Healthcare saying actually they would not be covering the long-term acute care respiratory rehab facility. Actually, they informed me that all he needs is the ventilator, the breathing machine, which they would cover, and really nothing else. So it's good to know, actually, that he doesn't need quality of life. According to United Healthcare, he just needs to breathe and lay in a hospital bed for the next 20 years. But it's chill. I'm fine. Everything's fine.
About two big changes to the Medicaid program. One of those changes is that if you are able to work and you are able-bodied, you have to work. If you choose not to work, you do not get free health care. You do not get free health care. Okay. So here's a question. Do you think that people who are 28 years old that can work and refuse to work should get free health care? I don't think that a majority of Nebraskans agree with you.
You ever notice how when people talk about Lyndon Baines Johnson, it's always Vietnam? The war, the protests, the body count, and yeah, that blood is on his hands. But what's never talked about? The fact that LBJ tried to build something no other president dared to. A great society. Not a good society, not a decent society. A great society where poverty was tackled head on, where civil rights were protected, and where health care wasn't just for the rich. It was 1965. LBJ had already signed the Civil Rights Act into law the year before, banning segregation in public places and discrimination based on race, color, religion, sex, or national origin. The man knew the government had the power to do something bigger than war. He said, "The Great Society is a place where every child can find knowledge to enrich his mind, where the city of man serves not only the needs of the body and the demands of commerce, but the desire for beauty and the hunger for community." That same year, With massive resistance from conservatives in the American Medical Association, Johnson signed Medicare and Medicaid into law, one for the elderly, one for the poor. Before that, 1 in every 2 elderly Americans had no health insurance. Let me say that again. Half of senior citizens in America couldn't afford to go to the doctor or get surgery or fill a damn prescription. Medicare changed that overnight. And Medicaid, that was supposed to be the safety net for those with the least. Pregnant women, kids, disabled folks, seniors in nursing homes, people scraping by paycheck to paycheck. But fast forward to today, 2025, and the legacy of that great society is hanging by a thread. Right now, nearly 90 million Americans rely on Medicaid. That's 1 in 4 people in this country. And yet Republicans are slashing access, imposing cruel work requirements, and letting millions fall through the cracks. Since 2023, over 20 million people have been kicked off Medicaid after pandemic protections ended. Many didn't even know until they showed up to the doctor and got turned away. LBJ would be horrified, because here's the hard truth. In the wealthiest nation on earth, healthcare is still treated like a luxury. Unless you're rich or lucky enough to have a good job with benefits, you're on your own. Compare that to countries like the UK, Canada, Germany, or Sweden, where healthcare is a right, not a privilege. You don't need to fill out 30 forms or sit on hold with an insurance company that exists to deny your claim. You get sick, you get care, end of story, period. But in America, we're too busy funneling tax breaks to billionaires and defense contractors while pretending we can't afford to take care of our own people. You want to talk about fiscal responsibility? Every dollar we invest in Medicaid or Medicare saves us in emergency room visits, untreated chronic illness, and preventable death. Cutting these programs isn't about saving money. It's about shrinking the government until it serves only the wealthy and well-connected and telling the rest of us to go fuck ourselves. So yeah, remember Johnson for Vietnam. That war was a disaster, but don't erase the other part of his legacy. Don't forget the president who stared down segregationists and said, "No longer will older Americans be denied the healing miracle of modern medicine." Because that promise, the promise of the Great Society, is being broken right now as I sit here recording this. We owe it to the millions of people who rely on these programs and to those who fought to create them, to raise hell before they disappear completely.
Why is the fucking president on the roof of the White House? Why is that happening? That's okay. Great. Marjorie Taylor Greene is done with Republicans. Yeah, girl, we know those men suck. Where have you been? Like, he's just up there. He's just like walking around up there. What is he doing? We have just a little, hey, Mr. Oop. There's a woman on this app who is talking about Medicare closing down nursing homes, or nursing homes closing down because they're like, we know. Yeah. Yep. Are anybody's gas prices lower? Are anybody's grocery prices lower? Release the list. We're still waiting on that fucking list. Still waiting. How did he get up there? Is there like a hatch? What is that called? Is it a hatch? It's like a, how did he get up there?
Leave it up to the dudes that look exactly like Johnny to think it's glorious that millions of people are going to get kicked off of Medicaid and Medicare. 65% of all nursing home patients in the United States are there because Medicaid pays for it. And if you've been scrolling TikTok, you've already been seeing people saying they just got notifications that their grandpa's going to get kicked out of the nursing home. And Johnny, let me know how your insurance rates are going to be looking, because right now they're going to be doing gradual increases, but in 2027, bro, watch what happens to your healthcare premiums. I mean, it's glorious, right? I'm sure you want Pawpaw kicked out on the streets, but the fact of the matter is that the issue with Medicaid and Medicare and people losing those programs is going to affect the elderly more than anybody. And I hope that this affects the people that voted for it more than it does the people that didn't. And we know that's true because the poorest, dumbest people in the country, all the blades of grass cheering on the lawnmowers, are the ones that are going to be affected by this. So, I mean, the great economy, bro, do you not understand any sort of statistics? I mean, you probably can't read. You're probably illiterate. You know what I'm saying? So, I mean, what can we expect from pedophile lovers and supporters, you know? Anyways.
Is St. Francis Hospital in Tulsa seizing the elderly? Let's talk about it. When someone is declared legally incapacitated, a court can appoint a guardian to make all decisions on their behalf, medical, financial, even personal. In theory, it's meant to protect the vulnerable, but in practice, it can cut families out entirely and give full control to strangers and institutions. Let's talk about Leroy Theodore, a 76-year-old who went to St. Francis in Tulsa. His family had power of attorney, meaning they were legally supposed to make decisions, but the hospital filed for guardianship anyway, and then he vanished. The family didn't even know where he was taken. Okay, let's talk about Ken Donnelly, who was living at home being cared for by his daughter. She held durable power of attorney. Despite that, St. Francis initiated guardianship behind her back and a court granted it. He was sent to Laureate, St. Francis's own psych facility. No one told his family. They couldn't reach him for days. These are people who were already caring for their loved ones, and suddenly they were legally shut out. You may ask yourself, why would a hospital do this? Guardianship doesn't just mean control over a person's body. It can also mean access to their benefits. Think Medicare, Medicaid, pensions, and if the guardian is tied to the hospital, that's money flowing back into their system. According to an insider, at least 15 cases like this are either in court or in progress. Staff says morale is collapsing, meals are being cut, people are leaving, and some are now whispering, don't go to Laureate, you might not come back. If it can happen in Tulsa, it can happen anywhere. And this isn't just about St. Francis. It's about the entire guardianship system and how it's being used or abused. And I think this says a lot about our current healthcare system as it stands. Follow for more breakdowns on Oklahoma, because what happens here affects us all.
Give you 30 seconds on rural hospitals because this is important. You have 7% of Medicaid money going to rural hospitals. We're putting $50 billion. The president wants us, the Congress wants us.
There are a lot of questions about how you're going to dole that out and whether you have already made promises. Do you have any specifics for us?
Yes, it's going to be, they'll get the applications in early September. The money is designed to help you with workforce development, right-sizing the system, and using technology to provide things like telehealth that can change the world.
Okay.
But imagine if we can change the way we think about the delivery of health and make it more about getting people healthy so they can thrive and flourish and be fully present in their own lives and as Americans.
If I was retiring and going on to Medicare, here's exactly what I would do. I would first enroll into Part A and Part B of Medicare. The easiest way to enroll is online by creating an ssa.gov account, and enrollment takes about 15 minutes. Part A won't cost me anything because I've worked 10 years or 40 quarters in the United States and have paid my Medicare taxes. But Part B would cost me $185 a month in 2025. Having original Medicare is great, but it'll only cover my medical costs at 80%. So I would then enroll into a Medicare Supplement Plan G, which would cover the other 20% of my medical costs entirely. The only medical cost I would be facing is a $257 yearly deductible. Being a man, this is going to cost me about $150 a month. And yes, men, you have a higher premium than women do on Medicare supplement plans. I would then enroll into a Part D prescription drug plan that covers all my medication at the lowest possible price. And that would be about $10 a month. So for $345 a month, I would have the best health coverage money can buy you. I can see any doctor, any specialist, and go to any hospital in the country that accepts Medicare with no prior authorizations required. And if you need help exploring all your options when it comes to Medicare, press that Learn More button, and I'll personally reach out to you and we can discuss all your options. Thank you, and have a wonderful day.
The Department of Health and Human Services and the Centers for Medicare and Medicaid Services just pulled the plug on a federal policy that tied hospital reimbursement to COVID-19 staff vaccination reporting. So this rule, which was enacted under the Biden administration, required hospitals to submit staff vaccine data to the CDC in order to receive full Medicare payments. But as of this week, that reporting requirement is gone. So Robert F. Kennedy Jr., now leading HHS, has called the original policy coercive, saying it violated informed consent and created perverse incentives. So in his words, medical decisions should be based on one thing, the well-being of the person, never on a financial bonus or a government mandate, end quote. So CMS Administrator Mehmet Oz echoed the sentiment, saying that this rollback is about restoring clinician autonomy and putting power back in the hands of providers. But here's the controversy. While some call this a win for medical freedom, others say eliminating data transparency and incentives could put vulnerable patients at greater risk, especially in long-term care and high-risk hospital settings. This policy change is part of a broader HHS effort to move away from one-size-fits-all care models and remove financial pressure from clinical decision-making. So whether that leads to more patient-centered care or more fragmented standards, this all remains to be seen.
What I'm about to say, many of you will not like. This is a sore spot for many Medicare beneficiaries. But I just got off the phone with a client who enrolled in a Medicare Plan G supplement. Very happy with it. It's great insurance. No prior authorizations, accepted anywhere Medicare is accepted. 100% coverage after the $257 deductible. What a deal. Well, she just got a letter that said her premium is increasing 34% to over $300 a month. To her, it is no longer affordable. It is no longer worth it to have that flexibility because she's got to pick between food and insurance premiums. And it's a sad reality for many, many people on Medicare who want to keep their Medicare supplements. They have just gotten so expensive. The premium increases are out of control. And many people are going to be switching to Medicare Advantage plans at $0 a month in the annual enrollment period coming up.
Good afternoon. This is Russ from Russ's Rambling on in the wee hours of the afternoon here in northeastern Wisconsin. Did you hear the news? Thanks to Senator Ron Johnson and Glenn Grothman, our nursing homes are now kicking the elderly people out into the streets because Medicare and Medicaid have been cut. Here in the last week, our nursing homes that care for these people are calling up with their social workers telling people that they need to take their patients back home and take care of them. We know of at least 2 or 3 individuals right now that have been asked to move out and move into some type of a care facility that is managed by a family member or a married spouse who can't take care of them. This is what Ron Johnson did for you. All of you people that voted for him and your senior citizens and that are at Parkview Care Center and Marquezan Nursing Home, and I can go on and on and on and name them all. They're dumping them out in the street, just like they did the mentally ill. We saw senior citizens on the street this weekend when we went to church for the first time ever. They had a cart, they had their bed, and they were laying in the heat, hallucinating. Here in Oshkosh, home of Senator Ron Johnson. When you see Ron Johnson, you say, hey, Ron, thank you for throwing senior citizens out in the street. Because I know the Lord God Almighty, Jehovah Yahweh, he's going to throw Ron Johnson's ass into hell, right along with Glenn Grothman. And I'll tell you what, that's what's going to happen. Meanwhile, Pastor Jerry Parsons over at Most Blessed Sacrament, he had a church with air conditioning on. Did he bother to go over and give those people a glass of water or make sure they had food or they were taken care of? He just sat there and glared. You know, that's one priest that ain't going to make it into heaven either. And I certainly don't have a problem getting on here rambling on about bullshit like this. You know, I saw a lot of things this weekend. But throwing senior citizens and not taking care of the elderly in this street is going to fire up the Lord God Almighty greater than anything you'll ever know. And he's going to come down with his right hand of judgment, and he's going to bring judgment upon people like they've never seen before. We haven't only begun to see the tornadoes and the earthquakes and the hurricanes and the natural disasters come, and the judgment and the plagues and the locusts and sickness and disease. It's all going to come to this nation thanks to Senator Ron Johnson and Glenn Grothman and the Glenn Buell lardass, along with President Donnie Trump and all those in Washington and the MAGA Republicans who don't have a clue what they're doing because they're not reading their Bible. They're not reading the Book of Jubilees. They're not following what they're supposed to be. This is Russ from Russ's rambling on how Ron Johnson threw senior citizens out in the street by passing the big, bad, beautiful bill and Project 2025.
Here's something really crazy while we're on this subject of Israeli hospitals. Okay, I know it's in the news because Israel claimed that their hospital was targeted. Turns out it was actually 2 different IDF units that were located with their headquarters right next to the hospital. But put that aside for a second, okay? Did you know that of the United States taxpayer dollars, of which we spend about $4 billion per year on Israel, the Zionist entity uses that money to fund free universal health care for their citizens? Now, take a step back. Think about how insane that is. So Israel has free health care for all of their people. Not a huge country, right? But they have free health care for all of their people, and they pay for it with the money that you send them. So if you're out working on a construction job, if you're out doing DoorDash deliveries right now, if you're out, working as a slave in an office, in a cubicle, or a teacher, and you're educating our youth, your taxes are going to the Zionist entity to fund their free healthcare. Meanwhile, of course, in the United States of America, we have over 40 million people who have no health insurance at all, and another 40 million people who lack basic health insurance because it is so costly. So some people have some, just a little, they can cover some things, but not everything. Okay. Israel, free healthcare, you pay for it. America, you're getting screwed. You're working your butts off and you have no healthcare whatsoever. These private corporations are screwing us over, and that's exactly how the system is supposed to operate.
So I keep getting these comments that the cuts, this big, beautiful bill, is not going to impact seniors. Yes, it is. Absolutely, 100% it is. And I can tell you this because I work in this business, been doing this a long time. So these Medicaid cuts that are coming, the $1 trillion in Medicaid cuts are going to cut millions off of Medicaid. And that's going to include seniors who receive Medicaid for their long-term care in nursing home and assisted living. Medicaid covers that, not Medicare. It's not the same thing. It's a special Medicaid coverage, a Medicaid waiver that pays for nursing home and assisted living. Medicare doesn't cover anything long-term for living, okay? It just doesn't. So, people that think they know what they're talking about, oh, seniors get Medicare, it's not going to impact them. Medicaid isn't for seniors. That's false. Those seniors that are in assisted living and nursing home, they're getting Medicaid. They might have Medicare too, but they have Medicaid coverage for the long-term care. So there's a lot of misinformed people making really stupid comments, and I really wish y'all would just shut the fuck up if you don't know what you're talking about.
Why does insulin cost $5 to make, but they charge $300 or more to buy it? Because Congress banned Medicare from negotiating drug prices back in 2003. And that ban is barely starting to lift in 2026, and it'll only cover a limited number of drugs. My plan, full negotiation authority for all meds from day one. And we go further. We create a federal office of generic manufacturing to break pharma monopolies, because your life shouldn't depend on whether a CEO thinks that you're profitable.
My dad lives in a nursing home, and by now I'm sure you've seen the video circulating about the woman who's really concerned because her dad is getting kicked out of his nursing home due to Medicare. And this is just the anticipatory changes that the big, beautiful bill is putting into place. What people don't understand is a lot of nursing homes are actually owned by these big corporations, right? So the big corporations, your local branch isn't that, but they are owned by private equity, things like that. I know the one that my dad lives in is like that. And so the rules kind of come from on top. So it sounds like some of these nursing homes are figuring, well, we're not going to get reimbursed from Medicare in the future. So we're going to just start evicting people who, pay that way because we don't want to suffer the losses. And instead we'll try to fill those spots with people who pay out of pocket. Now, in my case, my dad, we actually pay out of pocket, or I should say he pays out of pocket for his nursing home care. But what is it going to do when I guarantee you 70, 80% of the people who are at my dad's facility are in some type of Medicare reimbursement, especially if they're in very long-term care situations. That is super common. I don't think people understand that. And so what's going to happen when these facilities can't fill the apartments because there's not enough people who can afford? I mean, to give you an idea, It's over $4,000 a month, guys. $4,000. I mean, think about like that. That's like almost triple my mortgage. Okay. It's crazy. And in my case, like, what would happen if I was in this situation? Because I'm thinking about that. Like, what's going to happen if like my dad's facility, for example, shuts? Because there's not going to be beds anywhere for these people to go. So the burden is going to be on the families. And like in my case, I don't have anywhere to put this man. And I don't live in a handicap accessible home. And there is no housing in my area. So I can't just like pick up and move. And I have a mortgage from 2011. Like I can't just move. Like that's not really an option. So like, I don't know what I would be doing if I was in that same situation. And I am really worried. And if you're thinking, well, I'm so lucky. I don't have anyone in nursing care. I'm not going to be impacted. Let me just tell you that this is just the one little arm of the ripple effect that this is all going to have, right? What's going to happen when hospitals aren't getting reimbursed for things? What's going to happen when your doctors are not getting reimbursed? They're going to go private practice. I'm telling you, this whole healthcare system is like on a house of cards. Like it's all going to come crumbling down, and it's going to come crumbling down fast, unfortunately. So if you are worried about this, if you have loved ones that are going to be impacted, or you know you're going to be directly impacted by this, please know you're not in this alone. Please give me a follow, give me a comment, because I want to engage with people that are going through this same thing, because it is not easy and we need to come up with strategies together. And sometimes it's nice to just have somebody to vent to. So anyway, I'm here for you guys.
I was talking to my mom about this move to Albania, and I was like, aren't you worried you're about to lose your Medicaid? Aren't you worried you could lose your Social Security as a result of this administration? Her dumbass said, no, that's only for undocumented immigrants. They're no longer able to. It was like, what do you, they were never eligible for any of these things. What the fuck are you talking about? She didn't vote for Trump in this last election. She didn't vote for anyone, because by then she had fallen down her stairs and broken her leg and was living with me. And she knew if I found out that she went and voted for Trump, I would have thrown her out. But she did vote for him in 2016. And now she's like, I don't like politics. I don't want to talk about it. I don't want to be in this country anymore. I just want to enjoy my final years. But it's like, where are you getting your news from? I don't watch Fox News anymore. You're watching Newsmax. And they're saying, this is why I think MAGA is still, they're not as scared as they should be, because they still somehow think it's all about the immigrants enjoying things they shouldn't be getting access to, specifically Medicare, Medicaid, Social Security. Like, they're not eligible. Sure, they were paying taxes into those services that went to eligible citizens, but they're not part of this equation. Why? It's not going to make sense to this group until they suffer the consequences. That's really, it's going to take way more than this for these people to understand they can't blame people who were never eligible or participating in the first place. But I also don't feel like screaming at a 70-something-year-old who's missing all her teeth. So she'll be coming to Albania with me. I love my mom, but she has lost her way. And I think the only way she'll understand what is happening is to get out of this fucking echo chamber and be in a different country and hear how the rest of the world talks about Donald Trump and see from outside looking in, Timothy Leary style, man, like how fucked up it is and how wrong she's been. She's not gonna get out of this while she's drinking the Kool-Aid. I have to remove her from the source. And I hope she's grateful for it when she does see it, because so many people don't have this option. God, it made me so fucking angry hearing her say that just now.
Okay, I'm going to say this louder for the people in the back. Medicare does not pay for nursing homes. I'm going to repeat it. Medicare, not Medicaid, Medicare does not pay for nursing home visits. Medicaid pays for nursing home visits. 60% of people in nursing homes are on Medicaid, because those are the other 40%. They used to be the 40% that had something and they had to spend it all, and they lost it all, including selling right down to their house, because they can have the equivalent of $2,400 worth of assets and cash combined. Once they do, then they're eligible for Medicaid. The only way Medicare actually covers a nursing home stay is if something happens, like you have a stroke or you fall and break your hip, or it's something that requires rehabilitation. And that's usually only for 100 days. There's very few exceptions that go over the 100-day rule. And at any point, you plateau because you're required to go to physical therapy, occupational therapy, speech therapy, whatever is deemed necessary, because you're in a skilled nursing environment. You're not in a nursing home. You're not in a nursing environment. This is a skilled nursing environment that Medicare will cover. If at any time Pappy plateaus during his therapy, they stop paying for it. Medicare says, done, motherfucker, done. We ain't covering it anymore. We're not covering their nursing home stay. It doesn't matter if Pappy can't do anything for himself. He quit making progress, so we're no longer covering it. But he isn't capable of, being out on his own and living at his own house. Sorry for your fucking luck. Or if at any time Grammy or Pappy say, I don't want physical therapy. I'm 80 years old. I don't want to fucking do therapy twice a fucking day at 80 years old. Don't fucking blame you. But guess what? Nanny and Pappy don't get their fucking therapy or their nursing home covered under Medicare. Medicare does not cover nursing homes. Only Medicaid does. So I hope all of you enjoy wiping the shit off of Pappy's ass, because you're the one going to be doing it now instead of the aides at the nursing home. But that's only after you quit your job to wipe the shit off.
Here's a little update for what's going to come down the pipeline in a couple months. So the annual election time is around the corner. Kind of feels like it's around the corner because it's August. So we agents kind of get ready for all this stuff August and September. So we tell you, please watch your annual notice of change in September. It's going to come into your mailbox or electronically. And pay attention, because that's going to tell you what's going on with your plans. Now, we are getting sneak previews and emails and such from insurance companies telling us what they're doing in some cases. Some of it we can reveal to you. Some of it we can't. We can't give you any plan details, and I don't have any plan details. Even if I knew them, I couldn't tell you, right? But what they are doing, and several cases right now, several insurance companies, we've been told that, like, United Healthcare, Aetna, they're big companies with big PPO plans, for the most part PPOs, and they are either discontinuing, right? They're not going to have these plans next year, and I don't know which one, so you can't come ask which one in particular. Look at your annual notice of change, and if it says not available next year, you're going to know that your plan is one of those affected, right? But what they're doing from the agent perspective is saying, here's a bunch of plans that are either your clients are on them, or they're, maybe you were going to put somebody in them next year. They're not commissionable for agents. So meaning you're not going to get paid. So what this means to you, the consumer, is a couple things. You're going to see, in my opinion, you're going to see many more agents and agencies not running drug plans for people, teaching you how to do it. We've done that for 4 years now. So I think we're going to see this is the big year where everyone's going to catch up. Because you can't work for free. I'm sorry, in the fall, when you've got 8,000 people to deal with, you cannot, with 10 people, service 8,000 people or 2,000 new people that want to come in, right? You just can't do it. It is absolutely impossible. We have October 15th until December 7th, right? It's a limited time zone. We can't hire temps. We can't hire temporary people, because you can't just pull them in and teach them a bunch of stuff and then they disappear again. You can't. It's impossible to do that. And so you're going to see more people not doing the drug plan. So you need to learn to get proficient at doing your own drug plan. We will have a video for you. We offer all sorts of information on here, our YouTube channel. We will help everybody with our free stuff. We just will not run it for you. Okay. The second thing you're going to see is be careful when you're getting a Medicare Advantage plan to start January 1st. Be careful that the agent and agency is showing you all the plans that are available, because some agents are going to be showing plans to you that are commissionable to them. So the ones that could be a better fit might not be commissionable, right? And they may not show you, right? So you want to make sure you're seeing all plans. And here's our philosophy and how we handle this. We'll show you all plans, but if it comes down to it that, hey, this Aetna plan's the best one for you, it fits everything, blah, 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 we don't get paid on it. We're just going to tell you, we don't get paid on this. So it's going to be a self-enroll. You're going to need to go enroll into that plan. The reason we have to do that is because with an enrollment for Medicare Advantage, drug plan, things like that, we have to tell you we're recording the call. We have to tell you all this stuff about how many carriers we represent. We take on all this liability. And then because anytime CMS or the insurance company can come along and pull, well, they ask for the calls. They say, hey, show us the calls that you did for this person. And if you didn't do it perfectly, they start, doing all sorts of stuff. And it's just the word, it's liability, right? We're assuming liability for a plan we don't even get paid on, right? We'll help you find it. But again, you're going to enroll yourself. And that means you're not going to have an agent helping you in terms of if you have a problem. Okay. Not to say, you're going to even have a problem, but if you do, just know you're not going to have an agent because technically we are not the agent on the account. So I'm not sure on the Medicare Advantage side of things how many agents are going to do it like that, like we are, but that's just what we got to do. We have no problem telling you what exists, but we just can't take on liability and free work. That's it. Okay. Drug plans, it's easy for us. It's just, same old, same old. We're going to give you the tutorial. We're going to teach how to do it. For our clients, if you're one of our clients and you absolutely can't figure it out, if you have questions, of course you're going to call us and get an appointment, whatever. So we do that for our clients because we're not going to leave people out to hang. So it's not saying, oh my gosh, we're never going to run a drug plan. We run hundreds of them in the fall. We just can't run 8,000. And that's to be expected, right? So prepare for a little tumultuous season again. Don't shoot the messenger. Be nice to your agent. They're not doing this because they want to. They're doing this because the insurance companies are forcing our hands to have to operate a different way. It just is like that. Otherwise, it's going to come to the point where agents are out of business. And maybe I know some people would be excited with that. But you know what? If we go out of business, I'm not on TikTok anymore talking about this stuff. So it's going to be that much harder for some people. I don't know what I would do. I think we were joking that we would open up a little, I've been doing cookie decorating and cake decorating. So I did the kids' birthday parties recently. And so we were joking that we can have JoJo, which is me, JoJo, and Titi, which is the other grandma. We can go have a little shop where she can make her chocolate chip cookies and I can decorate cakes and cookies, right? So maybe we'll do that if we happen to go out of business sometime because the insurance companies put us out of business. All right. So don't get mad at your agent, right? We're doing as much as we can do. Okay. So don't shoot the messenger. And this is where we've got friends, TIG Medicare. Okay. Chris Westfall's group over there, Senior Savings Network. Again, I don't know what any of these folks are doing. Stephanie App, great agents out there. So just, be nice to all of them. Be nice to their staff. Be nice to all of us. We're trying as hard as we can and we're still out here.
Let's talk for a second. I see that you stated the obvious. This person still has Medicaid, Medicare. Their insurance wasn't canceled. It was their contract with the nursing home. Let's state another obvious statement. 65% of these people's contracts are going to be canceled around the United States. Where are these people going to go if they don't have someone to take care of them? They're going to go into the streets. Who's going to take care of them on the streets? They'll have their insurance, but they won't have anywhere to live. They'll have no one to remind them to take their medication, no one to help them out of their wheelchair to go to the bathroom and take a shower, no one to help feed them. So what do you think is going to happen to them? I have more obvious statements I can make, but I think this one is just clearly enough for you for right now. What's going to happen to these people if they have no one to take care of them? I feel that my concept was also simple, so if you have an answer, please let me know so then we can start fixing these problems before they start happening.
We are on part 3 of the no pay saga here. Today's Tuesday, August 5th. It is around 6 o'clock. If you see this TikTok before like 9, 10 o'clock tonight, you got any suggestions? Because I'm about to read you the email I'm about to send to these people. Let me know. Inbox me your draft if you want to write one up. Comment anything you think I should add. But I'm going to read you what I got. Oh, stand by. I got to give the phone number to the Mexican place to my husband. Hang tight. That's very important. Okay, I'm ready. So I'm gonna read you this email. Now, if you remember, if you've seen part 2, or you need to go back and watch, I mentioned Tiffany in this email and Lauren in this email. Lauren's HR. Tiffany is like the payroll director or something like that. I don't know. Manager. I'm not really sure. Then I've got my business manager and my executive director here in my state. And that's all I got, because I handed my tablet in on Friday. I don't got access to Outlook. I don't got access to shit. So this is who I knew and who I could remember to email. So I said, hello. It's Tuesday evening, August 5th. 2025. I have reached out to Tiffany and Lauren. Lauren, I received your message because she did call me back yesterday in the middle of the workday. I was with a patient. So tried to call her back yesterday, tried to call her back again today, didn't get an answer. So I said, and I attempted to call back twice with no return phone calls. Tiffany has offered no response at all. Both my business manager and my director in my local office are also aware of the payroll issues that continue to occur every week that I'm supposed to get paid, and unfortunately it's out of their hands. After seeking further opinions, from y'all, it appears this is a problem with several employees at your company, even outside of Delaware. With that said, I will be filing a complaint with the Delaware Division of Labor, as well as the U.S. Department of Labor, the Wage and Hour Division, okay, because your girl ain't dumb, okay, I did my research. And I will also be contacting CMS. If you're not familiar with CMS, that is Medicare, okay? Medicare basically sets the guidelines. If you're not accredited by Medicare, you ain't getting paid, all right? You ain't getting paid by a lot of people. Basically, you might as well just go ahead and put yourself out of business because it's not going to happen. So I said I will be contacting CMS as well. As a Medicare accredited business, in parentheses, quite frankly, as any business, in parentheses, it is inappropriate and unacceptable not to pay your employees for their hours worked and then not respond to them in regards to payment issues, especially when it is confirmed that my time was entered. It is also completely unacceptable to have employees' compensation issues be ongoing for upwards of 8 months. As an advocate for myself and other employees, like y'all, of this company, I will be filing these complaints and continuing to seek my compensation from you as a business. This email is to inform you of these complaints being filed to allow you an opportunity to correct your wrongs before I reach out to an attorney. In closing, a couple recommendations for you. I would strongly advise that your payroll staff be available and in the office or by phone at the very least on payday Fridays for people that have issues such as myself. There is one staff member in my local office and her hands are completely tied in regards to the payroll once she submits it. We rely on your employees down south, where the payroll division works, to assist us with our pay. We are also told as new hires that we are not remote and that no one, unless given a remote title, shall be working from home. So that's extremely misleading for your payroll staff to be working from home on payroll weeks and virtually unreachable. Why of all weeks would you pick payroll week? Why wouldn't you work from home on the other week? I don't know, because I don't know how they do payroll, but apparently they do it a really complicated, fucked up way, and maybe they should fix that. I mean, your company is fucking ginormous. Like, fix it. It's not hard. If small businesses can run their payroll in their sleep, you should be able to do it just fine. Anyway, continuing on. That is extremely misleading for your payroll staff to be working from home, blah, blah, blah. Another recommendation would be to consider streamlining your PR and employee process and your pay codes for the on-call selections in the point care system. I have worked for 3 other agencies that use point care and have paid me on-call and have never, ever had an issue. One of those companies also being nationwide. Actually, it was 2. Once I sat and thought about that. And the other is a small local business. Another suggestion would be to make sure that your payroll staff is well educated. And then when they see payroll turned in for an individual who just works 7 days of on-call, 15-hour shifts each day, and $0 attached to that maybe they see that as a red flag and they contact someone instead of just not paying the employee. Like, I'm sorry, send a smoke signal, pick up the phone, email something. And again, I'm not in payroll. Maybe it doesn't come through the way I'm thinking that it does. Maybe you don't see that, but I would think because you have to see hours worked and the days worked. So if you see all of that and then it says 0.00, you'd be like, oh, that's not right. Who works that many hours for free? Erin or N. I don't think she's working for free. Let me call Delaware right quick. Like, no one did that on multiple occasions. I would urge you to consider what your week would be like if you did not get your paycheck last Friday or the 2 Fridays before that. If you couldn't pay your bills or there would otherwise be an interruption in your life in general, then I would strongly urge you to make sure that your employees are paid promptly and appropriately at all times every pay week, no matter what. Best regards. Earn. So, I feel like I'm a okay creative writer. I feel like I do okay with assembling emails. I can't speak good English right now here, but that's okay. I'm tired and I'm hungry. And I am a little nervous, but I do think that that's well written. If you have suggestions, please make them. Also, I did not include the EEOC because when I was researching, it looks like the EEOC is more for discrimination things. And I don't really feel like this is discrimination. They're just not fucking paying me. No, it's not about equal pay. They're just not fucking paying me. And if you see, your girl will be stressing, okay? It hurts so bad. Anyway, I'm very stressed. I'm very annoyed. I'm very anxious. And I'm very frustrated that I have not gotten any response. And I am appreciative of every single comment I've received. Honestly shocked at how many people guessed the company correctly. So I'm still not going to say their name because I said I wouldn't. But yeah. If y'all want to, like, I don't know, go in together on an attorney because you didn't get your paycheck either, we could do it. Give me a call. Anyway, give me any suggestions. Like, share, whatever, repost. I don't care. Let me know what you think. Have a good Tuesday. I'll update you when I get a response, if I get a response. And
absolutely not. There is no real way to implement this. It's more paperwork for everyone. It's more paperwork for federal government, for state governments, for county governments, for local hospitals, for independent providers. And you know what Americans really hate, Margaret? When you go to your primary care physician and you spend 20 minutes sitting at a chair, not even on the exam table, while they are inputting data into a computer. So this doesn't make any sense. We should be a society and a country that is connecting people to healthcare providers. I think the one thing that Dr. Oz represents that's a fair representation is we should be healthier as Americans. All right. Then we need to be moving out of poverty. We need drug prices. We should talk about that to come down. So go after insurance companies, do manufacturing here, make sure we can negotiate fair prices. Let states do that because I guarantee you will do a better job than the federal government. And lastly, get people early, easy access. Today, more than half or about half our small businesses don't even offer health care coverage. So you can get a job, but now what?
My fellow clinicians in Christ, we must put down the fraud. This is Dr. Charmaine Lawson Baker, and she was a very accomplished nurse practitioner that has recently been convicted of Medicare fraud. So during 2018 to 2019, Dr. Baker worked for a Utah-based telehealth company. During her stint there as a 1099 employee, she was sending her patients for unnecessary cancer genetic tests. She also actively participated in misleading phone calls, doing consults on patients in less than 60 seconds, where she neither examined them virtually or in person. She also convinced the patients that they were receiving free cancer screenings, despite these genetic testing and other tests not being designed to diagnose existing cancer. Other reports stated that she falsely diagnosed patients to justify the unnecessary tests, was also making history as one of the only clinicians to ever diagnose cervical cancer in male patients. Also, she never reviewed the test. So some of the tests that she sent out, when they came back, they required further follow-up. They caught something. Because she never went over the test, she never informed her patients. Total fraudulent claims made or submitted to Medicaid was more than $12 million. 1.5 of that went to the laboratories for their participation. And Dr. Baker also received additional kickbacks from the telehealth company for pushing these tests onto her elderly patients. Now, this is a very, very sad story for numerous different reasons. Dr. Baker was very accomplished. She made it all the way to a terminal degree. She went to some notable nursing programs throughout her career. She was named a nursing fellow. She was one of the first people in her community to start a nurse practitioner house call business. She was an entrepreneur in her community. She wrote papers. She was an author. She wrote several children's books, definitely making an impact positively in her community. And it's unfortunate that I think she's almost 60, probably about 58. This is how she would be remembered. The other issue is that as nurse practitioners and nurses and clinicians, doctors and everyone else included, patients have to have a certain amount of trust in our ability to do the right thing. When instances like this happens, it undermines public trust and it makes it harder for all parties involved. It makes it harder for nurses and nurse practitioners to do their job, and it makes it harder for patients to interact with the system because they feel like when you suggest things, you're trying to get one over on them. Remember, children, please lay off the fraud because CMS always get their man or woman.
Big beautiful bill. So for all y'all said that the changes to the Medicaid program were only for the able-bodied people. We just got to get these people to work. You said it was not going to impact the disabled or the elderly. Yeah, I invite you to scroll your TikTok timeline today and see all the families that got notices that said that they have to get their parents and their elderly people and disabled people out the nursing home because the nursing home is no longer going to be accepting Medicaid. Now you tell me what's going to happen to these people. There's already a shortage of beds when it comes to this population anyway. So where they going to go? Home with the family? Families aren't trained in this type of care. They can't afford to have nurses to come in. If they could, they wouldn't have their people in a nursing home, right? A process of elimination. No pun intended. Tell me what's going to happen to these people. Because your administration doesn't want Medicaid. And what's sad is that this is just a precursor to the impact of the big bad bill. Yeah. Y'all voted for that.
Do you know what's going to be the ultimate result of you being an ableist piece of shit? Going on the internet and saying, I'm okay with these Medicaid cuts because I'm an able-bodied person and we just need to quit expecting the government to give us handouts. Listening to the Trump administration saying that this is just about waste, fraud, and abuse and refusing to read the goddamn bill. The result of that is going to be that you one day are going to be sitting there with your thumb up your ass when your mima in the nursing home loses her Medicaid coverage and can't afford to stay in the home anymore. You're going to be sitting around going, what's happening? When they take away your kids' SNAP benefits and you have to send them to school hungry. We are all one traumatic injury away from losing our jobs, losing our health care, and being unable to afford groceries. Your child is one traumatic brain injury away from needing special services at school that require Medicaid coverage for the rest of their school life. And y'all are frothing at the mouth so much to watch people drop dead because they can't afford to take care of themselves or feed themselves that you're willing to overlook all the other shit in this bill. Your dear, darling, genius child you've wanted to be a doctor their entire life won't be able to afford medical school anymore because the government doesn't think that they have to help with those. In fact, your child, who probably is going to need Pell Grants and assistance of some kind, won't be able to afford college at all, much less medical school. Y'all, I had to record this in my car because I was so goddamn mad. I didn't want to disturb the neighbors. So frustrated right now because everyone is just wanting to see other people suffer. Where is y'all's humanity? Where's the humanity? We've lost it all. We're just willing to let people starve, including children.
So all jokes aside, y'all, so they taking Medicare and Medicaid out the nursing homes? That's crazy work. Y'all see how y'all was so over Trump? Now look at y'all grandparents in them nursing homes and your moms and dads in them nursing homes. And I'm not even trying to be funny because I like all people. I love all people. But black people are all the shades of people that you see in them nursing homes, from the nurses to the CNAs, the STNAs. We take care of our older generations, our grandmas and aunties. They, majority of the time, are at home with us. But are y'all YT people ready to have to take care of y'all folks? Because even if they taking Medicare and Medicaid out of the nursing homes, don't y'all think that they would be taking them out of, like, what's about to help into the home health aides in them agencies because they accept Medicare and Medicaid? Yeah. But y'all can thank Trump, though, since y'all was all, for him. Now y'all about to be at home. Because, you know, Medicaid and Medicare supply the wipes, chuck pads, all of that. But yeah. Like y'all dead ass be having fights among yourselves about who's gonna take care of mom and who got time to do XYZ, and y'all dead ass drop them off at the nursing homes with us.
Is St. Francis Hospital in Tulsa seizing the elderly? Let's talk about it. When someone is declared legally incapacitated, a court can appoint a guardian to make all decisions on their behalf, medical, financial, even personal. In theory, it's meant to protect the vulnerable, but in practice, it can cut families out entirely and give full control to strangers and institutions. Let's talk about Leroy Theodore, a 76-year-old who went to St. Francis in Tulsa. His family had power of attorney, meaning they were legally supposed to make decisions, but the hospital filed for guardianship anyway, and then he vanished. The family didn't even know where he was taken. Okay, let's talk about Ken Donnelly, who was living at home being cared for by his daughter. She held durable power of attorney. Despite that, St. Francis initiated guardianship behind her back and a court granted it. He was sent to Laureate, St. Francis's own psych facility. No one told his family. They couldn't reach him for days. These are people who were already caring for their loved ones, and suddenly they were legally shut out. You may ask yourself, why would a hospital do this? Guardianship doesn't just mean control over a person's body. It can also mean access to their benefits. Think Medicare, Medicaid, pensions, and if the guardian is tied to the hospital, that's money flowing back into their system. According to an insider, at least 15 cases like this are either in court or in progress. Staff says morale is collapsing, meals are being cut, people are leaving, and some are now whispering, don't go to Laureate, you might not come back. If it can happen in Tulsa, it can happen anywhere. And this isn't just about St. Francis. It's about the entire guardianship system and how it's being used or abused. And I think this says a lot about our current healthcare system as it stands. Follow for more breakdowns on Oklahoma, because what happens here affects us all.
Why aren't nursing homes and rehab facilities accepting Medicaid contracts anymore? They're starting to not accept them. Let me let you in on a little secret. The big, beautiful bill. That's why. You know, the bill that was passed and signed into law. See, voting has consequences. That's why we need a robust federal government, because now it's been passed down to the states. Do you think the states can afford it? No, they cannot. So what does that mean? That means they're going to start shutting down. That means if you have loved ones in a nursing home, in a rehab facility, they're probably going to have to go live with you, and then you can figure out how to take care of them. Because many of you voted for this nonsense and foolishness, and you're not even rich. See, if you were rich, I could kind of understand it a little bit. It would make a little sense. But if you're not rich, why would you vote for this? So if you got a loved one in a nursing home, I have one. I have a close family member in a nursing home / rehab facility. So we're probably going to have to figure something out too. And also that means longer hospital visits, longer emergency room stays. All because some people are one topic voters. I don't believe in abortion. I don't believe in the LGBTQ community. You have to be more than surface voters. You got to look at the whole process. Plus, it was all in Project 2025. If you would have taken the time to read it, you would have known that. Anyways, guys, I don't want to go off on a tangent. I'll talk to you later.
I bet y'all didn't hear about that Medicaid fraud takedown they just did. Trump's DOJ just arrested 324 individuals who were participating in a healthcare fraud scheme involving $14.6 billion with a B in fraudulent claims. They did a whole press conference on it. Take a listen.
Their alleged participation in healthcare fraud schemes involving approximately $14.6 billion in false claims submitted to Medicare, Medicaid, and other healthcare programs. We dismantled a scheme involving a sophisticated operation run from Russia and Eastern Europe that strategically bought dozens of medical supply companies in the United States and submitted more than $10 billion in fraudulent healthcare claims to Medicare. To make matters worse, these perpetrators used the stolen identities of more than 1 million Americans spanning all 50 states to perpetrate this scheme and submit these false claims. But I'm pleased to report that federal agents intercepted and arrested key members of that organization at U.S. airports and the U.S.-Mexico border, cutting off their intended escape routes.
According to Dr. Oz, he said this is the largest Department of Justice fraud takedown in history. But this doesn't surprise me. Our healthcare system has been a mess for years. And the way
All right, Social Security. Let's get my baby boomers 65 and above who get Social Security, people who are on the cusp of getting Social Security benefits. Check out this title about Social Security. I think you didn't know, or you forgot, or you didn't believe that Project 2025 that has been about 48% completed by Donald Trump so far this year is the goal is to privatize Social Security. Uh-oh. Baby boomers, MAGA, you didn't know about that. You didn't think about that because Trump said he would never do that. This is a little bit of FAFO for baby boomers, MAGA particularly. So if you look right here, you can Google this. In fact, I encourage you to because I am not a cult. Project 2025, the first goal is to privatize Social Security. What that means is to give it to their rich friends so they make billions of dollars like their other rich friends, to raise the retirement age, to cut back on Medicare. If you didn't see my viral video on how Medicare is going to be cut starting in 2026 and confirmed by a senator, you better check that out. But also, this will hurt this group of people. So baby boomers, MAGA, Social Security, if they privatize Social Security, don't claim you were warned because you were warned. Follow for all things personal finance and economic news.
These old folks is about to get kicked out of the nursing home due to the fact that this big, beautiful bill passed and is about to cut Medicaid and Medicare. These old folks are about to get kicked out of the nursing home. And these old folks, they rely on Medicaid and Medicare because it's paying for them to live in these nursing homes and getting all this treatment and getting all the help they need. And it's covering their medical bills and all that, and their prescription of drugs as well too, and all. So the question is, where are all these old folks gonna go? And some of these old folks don't have kids to rely on, and some don't even talk to their kids or grandkids or family members. So y'all have to think about that. And some of you Mr. Charlie supporters of all got family members is on Medicaid too. Think about that also. Because once Medicaid's cut, it ain't going to be no Medicaid no more and all. You're going to have to pay your family members and your parents health insurance bills, copay, medicine, all that and stuff. Food, everything and all. Thanks to you, Mr. Charlie supporters that vote for this man. Y'all think all that's going to be gone. No more taxes taken out my paycheck, no. And you think he's going to end that tax return next year? No. It's all is just money in his pocket. And you, Mr. Charlie supporters, just don't see it. Y'all need to wake up and smell reality. This man is not doing no favor for nobody. He is trying to make everybody's lives miserable. He's trying to have people die. And all. He don't care about the working class people. He don't care about the poor people. He don't care about people that's on SSI, Medicaid, Medicare, welfare. The only thing he cares about is his own self. And that's about it. He cares about wealthy people, rich people. He look at us as barbarians, scumbags. Like somebody he can just spit on and just stomp on. Mr. Charlie and the posse do not care about what you're going through in life. He don't care. His family ain't suffering. None of that. He's getting all the medical attentions he get. While these old folks are going to suffer the most, getting kicked out the nursing homes, and some of these old folks can't take care of themselves. They is going to die slowly. A sudden death. And some of these old folks, like I said, don't have kids to rely on. So who's going to take care of these old folks? That's the question. That's why I feel bad about these old folks. Because they need this. Y'all need to wake up and smell reality. This man is sitting there taking everything away from us. Our freedom of speech, our rights, our benefits, everything, the jobs, all that. He is firing people left and right. Like this man want to go to war with countries and all, and then not to mention and all, we're targets here in America. Tomorrow's not promised. You don't know the next day we could be all blown up to pieces. You don't know what could happen. It's just getting out of control with this Mr. Man going on. Mr. Charlie and the posse, he just something else. Like, he do not care. And then he's trying to get rid of all the Latinos and Hispanics, all the minorities out of America, lock them up, detain them, want to remove all the homeless people, put them in mental institution centers. It's crazy. Like, this man's out of control. And he's a true dictator. Like, if you speak about, say his name, he will lock you up with no quick hesitation. It's just crazy how this man is coming. Like, this man should not be the president of the United States of America. This man got so many felonies. It's unbelievable. Still to this day, it blows my mind how this man is president of the United States today. It's crazy. All these felonies and stuff. Can't no average person do that with all those felonies. Why this man got money? We don't. It just show you what money could do. What you could do when you have money. And like they say, money's the root of all evil. It is. And a lot of people just don't see that. Like this man, Mr. Charlie and the posse, he is just getting out of control. It's going to be so many people getting laid off, getting fired at their jobs. Because all the nursing homes, the doctor's office is all going to be shut down. Even the hospital is going to be shut down due to the fact that Medicaid is going to be cuts on it. And slowly by short, it's going to reduce down. Ain't no money for Medicaid no more. Ain't going to be Medicaid. Ain't going to be Medicare. Ain't going to be Social Security no more. Watch. They're going to target Social Security. For what I was told, they're going to give Social Security to somebody else and all. And you don't know what that person's going to do with the Social Security. He could probably kick so many people off and just pocket that money. You just don't know. And the question is, all these cuts and all that, this man, Mr. Charlie and the posse, ain't telling us where's all this money going to. Where's it going to? But we all know the truth where this money's going to. In their banking account. And that's a fact.
Well, from today's episode of FAFO, if you know, you know. Where it is that they're no longer accepting Medicaid and Medicare in some of these nursing homes. And if you have CNA friends or friends that are nurses or anything like I do, that work in the nursing homes or work in the nursing homes, they tell me that it's only a fraction of us in the nursing homes. But there's a plethora of the other people in the nursing homes. So what that means is if they no longer take Medicaid and Medicare in these nursing homes, some of these people will have to take care of their relatives. Because see, what you don't understand is us people, we rarely put our people in a nursing home. If they go in a nursing home, that means it's probably only one child left that is, probably ailing themselves. Or that person was just such a horrible person that, nobody wants to take care of them. But the other people, they put their people in the nursing home because they just don't want to do it. So for all of those people that voted for him, you got to take care of Mama and Papa now.
I am made up of ibuprofen and the grace of God at this point. I don't even really know how I'm still going.
Thank you for watching Great Minds Blacks.